Okay.
You know they wear earring. Because you dey fine, you dey proud. You don't need the earring. Your pride. Your pride, you don't dey proud though. I don't dey watch you, this girl. Say I don't dey watch. You know humble again.
I see humble now.
You know humble. This girl don't dey humble again. This girl wait. Let me hear no.
No, I see humble.
Don't dey proud.
Hi guys, welcome back to the channel. So continuing our episode or our series on all you need to know about studying medical courses in BOWEN University. In today's episode, we'll be talking about physiotherapy. And with us is the newest physiotherapy in town.
You put that.
This is Shoma.
Hi guys, as she said, latest therapist in town. You got glory. My name is Choma. I am the creative director behind SBO.co and I'm also a content creator and most importantly a physiotherapist.
Gege, that's so nice. Anyway, so before we go into the video to talk about physiotherapy in BOWEN University, we shall be talking about, first of all, we want to like debunk some misconceptions that you guys or some people that are watching this video or that may watch this video or come across this video have about physiotherapy. So I think I'll go first. So I think one of the misconceptions I've heard about physiotherapy is that they only deal with bone and like, bruh, that's not true.
Yes, that's not true. We deal with bones, yes, we deal with muscles, we deal with other like body parts that have to do with physiotherapy basically. So bones, muscles, it can be your hand, it can be your neck, it can be your thigh tomorrow, you know. There are other injuries that are predisposable or that physiotherapists like end up like working on. So it's not only bones.
Is it true that when physiotherapy? I know it's not true, but like I'm just asking because I know some people who want to ask or some people think of that. I think that physiotherapists are masseurs, like bro.
Please, we do not only. I don't know why. I don't know why everybody always thinks therapy we only do with massage. Like it's not only massage. We mostly with exercises and the use of other therapeutic modalities to treat. So please don't go out and say, "Will you massage me today?"
It's not funny.
It's not funny.
It's not funny. Stop it. This is 2023. Let's do better. Anyways, we're done with the misconceptions, so we want to go into the main thing of the video to give you guys all you need to know, or like inform you guys on what it is about studying physiotherapy in BOWEN University. So the first question that I'll be asking, first of all, in case I'll be looking down, the questions are written down, so I have to be looking down at the paper or at the book to get the questions. So first things first, can you describe like how physiotherapy is in BOWEN University in like a sentence or two sentences?
Interesting.
Interesting.
I can't lie. I think it's because I like physiotherapy a lot, but to me it's very interesting. And studying is boring. Was not the easiest, but it was interesting.
Okay. All right. So next question: how many years does it take to study physiotherapy? Like how long is it? Like
5 solid years.
5 solid years.
5 solid years.
Wow, that's a lot.
But they're about increasing into like 6 now. So
why?
I think the set after mine or the set 2 sets after mine will start 6 years.
Why?
I don't know. I really don't know the curriculum, but the curriculum has changed after my set.
Oh.
So it might be 6. For those that might want to do like DPT, that want to carry a DPT, it might be like DPT? Doctorate in physiotherapy. So it might be like an extra.
Yeah. That's nice. That's nice. So in physiotherapy, when do you guys start your clinical year? Like when does the clinical year start?
So clinical year starts in 300 level second semester. That's when you start. So you start clinical from 300 second semester. Yeah. That's when you come to BOWEN University Hospital.
Okay. So the next question, in physiotherapy in BOWEN University, do you guys have like professional exams you guys take, like to cut out people or anything like that? Like, is there like a reading exam? Hey,
there's a reading exam. There's a reading exam. It's not even based on our intelligence. It's based on God. It's God that will help you out of that place. Our first professional exam is in 200 level. End of 200 level, we write it MBBS, nursing. So that's the first readout. Then there's one before you induct. That's the one that I'll be writing soon. That's the MRTB exam, which they don't people pass it a lot, so they don't do that. And then there was supposed to be there's a professional exam aside from MRTB. The MRTB was like organized. MRTB is Medical Rehabilitation Therapists Board of Nigeria. So MRTBN. So they're the ones that organize like exams. So there was supposed to be a professional one this year, but it didn't happen. So I'm thinking from next year they're going to have like a more professional exam before the one, because there's one you write before you induct, and there's one you write before, like after your final year exam, there's one that you write. So I think that one will start from next year. They'll start with the sets coming in. but we
Okay.
write the exam before the induction. So if the induction is tomorrow, you write an exam today that will
Wow.
qualify you.
Well,
Mostly an ethics exam, so it's not
okay, it's not
really,
really like
it's not,
studious
no, you don't
exam.
have to.
If not, I'll be like, before you
They'll
induct,
teach
like
you that day and then
the
you
next,
write, no, you write it that day.
oh, you
They
write
teach you
that
in
day.
class and then you write the exam
So it's
immediately
basically like
after.
a test or
Yeah, it's an
something.
ethics exam basically.
Oh, okay. Okay. That means it's not so
No,
big
it's
like
not, it's
anything.
not, it's not.
It's
See, they
not
should not
big.
hear me. It's not.
Anyway, so in physiotherapy in Bowen University, do you guys have like a dress code or anything?
Well, your normal corporate,
Mm-hmm.
we are very like they're very sure when it comes to like your dressing. So you have to be very you have to be on corporate. Then in 300 level, second semester, because it's clinical, so you be on your scrub most of the time. And if at all you're tired of wearing your scrub, you want to be a fashion girl,
Mm.
and hey, you can put on your work coat with your dramatic clothes under.
Is it the reticle on that? Okay, so it's not as if like you guys have like a color
No,
code
our
like
color of our scrubs blue and grey.
okay, so it's only the scrubs that have like color code, but like for
Yeah,
normal corporate wear, it's just
normal
like
clothes.
normal
Yeah.
normal
And we
color
have a normal, everybody has a universal word code, so that's the uniformity that comes with
comes.
our corporate.
All right. Okay, so the next question: do you guys have like a free time? Like, let me say, like you know how in medicine we don't really have holidays. Like there are no breaks or semester breaks or something. Do you guys have like breaks or holidays, stuff
Well,
like that?
physiotherapy is interesting, and because it's interesting, there's time to do what you want. Honestly, I would say that when also there's no time when you have to prepare for like exams or prepare for like in courses,
Okay.
but with physiotherapy there's time, there's time, there is not like there's plenty time. Like we are not serious, so we are serious, but we have like good amount of time.
I think you guys have
Yeah, to
holidays,
have
breaks.
hobbies, we have holidays, we have breaks. But some of the breaks, like your 300 second semester now, you are working. You have like your 6 week CIRS compulsory. And at the end of your 400 level before you enter 500 level, you have a 3 month CIRS. So that's like a mini. Those are like mini internships. So aside from that, I'm talking about free time in terms of class. Like the timetable is very flexible, so you have
Okay.
time for yourself to read, to pursue other interests. Yes, but when it comes to like after school, after exams, after each semester, no, you have to do your compulsory mini
Mm.
internship called Cyrus.
All right. So that makes sense. So, um, can you tell us your best and worst part of studying physiotherapy in Bowen University?
I don't know if I have like a worst part of studying physiotherapy. My best time, I think my best part of studying physiotherapy is when I do well in all my exams. It makes me feel like as if
Mm-mm.
I'm ready to face the world, like I'm ready to be a physiotherapist. I think that my best time is doing well, basically. My worst times, I think I won't say worst times, but I think the times when you're about to do your practical, the whole experience, like cubicle one, cubicle two, the anxiety. But after like 400 level, you start to there's nothing to be afraid of. Like, that you need to do, and keep it in.
Okay.
Yeah.
So that means you guys have like clinical based
We
exams,
have clinical basis after
like all
your
these like OSCE exams are like you go to
hmm,
this station, this station, this
after
station.
your written exam, you have that clinical exam. It is not a joke. I won't say it's a joke. It's not a joke at all. You have to read, you have to prepare, you have to know your stuff. But at least I would say don't beat yourself about it, because even if one cubicle doesn't work out, the other cubicle is going to work out. And you're not dumb if you don't know something. You will know it the next time. There's always enough time for you to improve. Do you understand? So
Mm-hmm.
yeah.
That makes sense. Let me see. So, last question. Now, what question am I going to ask you now? Okay. All right. What are the career opportunities that you tend to have in
Hmm.
physiotherapy?
Guys, there is a lot in consider. There are so many career opportunities. You have women's health, you have your normal, you have your neurology, orthopedics, you have bonds, you have
Mm-hmm.
pediatrics, you have like I said, women's health, you have sports therapy, you have ergonomics, which
Mm-hmm.
is already becoming very, very prominent.
Mm-hmm.
I think cardio, you have cardiopulmonary also. You have
That's a lot, though.
that's a lot. Like
You
it's like
actually choke.
as it's coming, like I try to remember, but there are a lot of career
Yeah, the same
opportunities.
career opportunity. So, on a scale of 1 to 10 or a scale of 0 to 10, how would you rate studying physiotherapy in Bowen
So
University?
that's very when it's not the easiest, but it's interesting, like I said. So
Mm-hmm.
I'll rate it. But I'm not trying not to be biased because my tutoring community were tight. So I'll not say 10 out of 10, but let me just be that mean teacher. I'll say you only 1 mark because you're doing too well. So I'll say in an 8.5 out of 10. Let me tell you why. Our
Okay.
lecturers are amazing. Like even the ones that are strict with us, the ones that are not that just free mark or some mark, those that are not pity us and make us repeat a course, they are actually nice. They fight for us. and they give us the best form of education. They do. Like they do. I can't even like lecturers are they are the best. I can't lie. Yes.
That's so nice. So if okay, in this video now, if someone is watching this video, do you think that it's advisable for the person to opt to study physiotherapy
Please
in
study
BOWEN?
physiotherapy. Physiotherapy is very I don't want to say chill for you putting
In
on
BOWEN,
serious.
or like
So
in BOWEN,
yes,
go
in
go go.
BOWEN, let me tell you something. Once you cross over the 200 level, the 200 level exams, 300 level is easy. It's not the, it's, but you're transitioning into clinical, so I
Mm-hmm.
won't say it's the easiest, but it's easier. There's less pressure. Although if you sometimes you have to resit a course like if you don't do well in preclinicals, but in preclinicals they give you more chance to settle in, to find like okay, this is how I want to study,
Your
find a new reading
balance.
pattern, find a balance, they will even like talk to you. So even if you know in certain level, you is that you repeat, you repeat, you
Receipt first
repeat all those kind of things.
yeah.
But in
Drama.
clinicals, if you fail a course, you resit it and you even do better. So you have more understanding, you found your balance and it's less and less anxiety. Yeah. Mm. So please
So
come to BOWEN and study physiotherapy. The department is amazing, full of amazing people,
very
amazing
physiotherapy.
lecturers, and our students union in physiotherapy is that they're amazing people. So yeah.
Hope you heard it right from the
Yeah.
right source.
But lastly, before we end
Ah,
this, I want to tell you guys that please like the thing about excelling in school is that you have to just be the best for yourself. Do you understand? Like
yeah.
I know I always say it's that you know it or you don't, but try to know it.
Yeah.
So yeah.
Anyways, guys, thank you for staying this far and watching this video. If you have any more questions concerning physiotherapy in BOWEN University, do well to comment, and then Choma will be there to answer your
Yes, I
questions.
will.
And she's not there as usual. I'll always bring her to come and answer your questions. And don't forget to like, share, subscribe,
Subscribe.
and send this to somebody that you know that wants to study physiotherapy in BOWEN University. See you guys in my next video.
Bye.
Bye.